Our goal with our DNA sequencing, or what's known as our genomics project, is to, when patients get a biopsy, sequence the DNA in their tumor to identify new treatment approaches for them. We had a lovely gentleman who came to Dana-Farber to get a second opinion about how to proceed with his therapy. When he underwent a biopsy to make the diagnosis of his cancer, we took tissue from that biopsy and sequenced thousands of genes within that tumor. And when that information returned, which was about 4 weeks later, we realized that his tumor had a mutation in a gene called BRCA2. Many people have heard of this gene because of its relationship to breast cancer and the fact that it can be inherited from one family member to a family member in the next generation. However, in this case, this was not an inherited mutation. This mutation had developed in his tumor. The patient then continued to receive his chemotherapy, and as his chemotherapy proceeded, his tumor receded, and he actually developed what we would call a complete response, which meant that the tumor that was seen, both the tumor in the pancreas and the tumors in the liver, disappeared, were no longer visible on CT scan. After 6 months of therapy, the toxicities, the side effects of chemotherapy do begin to build, and continuing chemotherapy can be quite difficult. There are large studies in ovarian cancer and breast cancer looking at using a particular class of drugs, what are called PARP inhibitors, in patients who have BRCA alterations that were inherited and developed breast or ovarian cancer. And there now are several drugs that are approved for use by the FDA that are PARP inhibitors in this setting. We were able to work with his insurance company to obtain one of these drugs and apply it to his care, even though this drug is not yet approved for treatment in pancreas cancer. The patient has done extremely well on this medicine now for almost 2 years, over 2 years since his original diagnosis, with continued no evidence of cancer on his CT scans. And we believe that knowing the mutations in his tumor has allowed us to tailor the therapy to this specific patient and allowed him to not be on chemotherapy for almost 2 years and instead receive a targeted drug that's very specific to a tumor that has a BRCA mutation. And this is an example how using the growing understanding of the biology of pancreas cancer can allow you to tailor therapy for patients, improve their quality of life, and allow them to live longer.